and weekly planning meetings have been held to ensure several objectives were met, including ensuring food insecurities are met, requesting and distributing PPE, planning for local community testing, supporting the governor's missions, assisting in plans for an alternate care facility, providing guidance on the federal and state reimbursement process, and providing guidance to several nonprofit organizations. Emergency management has and will continue to be the conduit for resource requests, which include personnel, equipment, public information, and guidance. There have been multiple requests to the state of Iowa from Woodbury County from a variety of different agencies. The most common during this time has been requests for personal protective equipment. Woodbury County has received 12 shipments totaling approximately 2,100 boxes with over 205,000 single items that were distributed. Emergency management continues to have the opportunity to work with local volunteers who continue to show their support for their local communities. Through this, we have had several volunteers assemble approximately 1,200 homemade masks that have been distributed to EMS, fire, correctional officers, and law enforcement personnel. Due to the number of masks donated, EMA was able to shift the focus and provide masks to all Woodbury County employees, including the court system, as well as several nonprofits who have continued to provide services throughout this trying time. With that, I will turn it over to Tyler.
Thanks, Becca. I thought I would start with just talking a little bit about the data trends as far as new cases and things like that going on with COVID-19 in Woodbury County. Last week we had 261 confirmed new COVID cases. That marks the third straight week where we've had decreasing cases. The week before we had 319. The week of May 10th we had 448. The week of May 3rd, we had 790, and then April 26th, we had 695. So again, this is the third week in a row where we've had decreasing amounts of new cases. The positivity rate along those times, last week it was 17%, and the week before that it was 16%, and previous weeks were at 21, 30, and 45. So again, even with our positivity rates, you're seeing, a pretty good decrease from where we were at the beginning and certainly where we were at our peak. We do get questions from time to time about why do we keep emphasizing this positivity rate? And I wanted to, and I'll take a second to talk about that. When we just report cases, it doesn't, without the context of how many tests were done, it's kind of irrelevant, frankly. Yes, of course, we need to know the number of new cases, but we also need to factor in the amount of testings done. So if we do 200 if we get 200 cases, but we did 2,000 tests, that's a much different scenario than when we get 200 cases and we only did 500 tests, for example. So that's why we really focus on the positivity rate so that you can get an idea and we can put some context to those numbers. So we want to emphasize that things continue to improve in Woodbury County, but we've still got a long ways to go, okay? We still continue to see quite a few new cases, and as we open up things more and more, we just want to really emphasize that social distancing. Some of the same principles that we've had in place really need to stay in place. Of course, we want businesses to open up. We want to start having a little bit of fun again, right? But we still need to continue to practice social distancing and the same concepts that we're doing so that we can continue this trend and that we don't see a spike up as people relax some of these efforts. Testing availability. We had a lot of discussion last week about Test Iowa leaving Sioux City. And while that has happened and it certainly got a lot of attention, I want to continue to emphasize that we have a lot of testing available here in Sioux City, here in Woodbury County, and that's expected to continue throughout this outbreak. Woodbury County, again, has been one of the leaders in getting testing done, community testing done, and we fully anticipate that continuing. As of today, we've we've tested almost 11,000 Woodbury County individuals. And so, and only 718 of those tests were done through Test Iowa. So while we appreciated Test Iowa as a resource, an additional resource for our community, the vast majority of testing of people that's been done here has been done through our community partners in the medical field, and because of their efforts, we now rank #1 in terms of the total population of Woodbury County that has been tested. So right now we're sitting at over 10% of the individuals that live here being tested. Just as a comparison, other comparable counties, Black Hawk County is at about 7%. Dubuque County is 5%. Dallas County, Polk County are all at about 5%. And Lynn County and Johnson County are at 4%. So to repeat, we're at over 10% of our population that's been tested. And again, testing has not been a problem here thanks to the partners in our medical community, and we fully anticipate that continuing. If you need a test, the process is call your doctor, okay? Call your doctor. Your doctor will be more than happy to arrange for testing. We have multiple locations where that can be done. The doctor just simply needs to order that. If you don't have a doctor, you can call Siouxland Community Health Center to help get started with that, or I'm sure any of the other providers in town would be more than willing to kind of help you along that process. So the other hot topic right now is this concept of contact tracing. Okay, contact tracing is kind of a buzzword this last month or so, but really this is a concept that's been going on forever when it comes to public health disease investigation. This has always been something that we do for every disease that we encounter. It's just the nature of the disease makes a difference on what type of contact tracing needs to be done. Depending on how the illness is spread, we may have to contact these types of contacts. Depending if it's spread a different way, we might have to come in contact of people who've encountered these cases in a different way. Siouxland District Health Department is one of the few health departments that have kept all of our COVID cases and our contact tracing local. A lot of health departments, as cases have risen, have elected to send that to the state for the state's help in contact tracing. We felt that it was really important that we keep a local presence with that. We felt like if we turn that over to the state, we would lose some of the local the ability to know what's going on locally. And so even though it's been an enormous challenge with over 2,600 cases, we have maintained that challenge at Siouxland District Health Department. We have over 40 employees that have participated in contact tracing at one point or another. In fact, we have 30-some employees that will be working tomorrow doing the same thing on a Saturday. Some of the basics that come into contact tracing is, the goals for COVID-19 of contact tracing is to identify new cases, of course, to isolate symptomatic contacts as quickly as possible, and to quarantine those close contacts that are not symptomatic yet, but may develop symptoms as we go on. So each case is contacted by Siouxland District Health Department. All 2,600 cases have had contact attempts made, and so we focus on household contacts. We know from this outbreak and from all the cases that we've had that spread in households has been one of the primary drivers of the spread of this. And so we focus on household contacts as well as non-household contacts that have had spent time less than 6 feet away for more than 15 minutes. Okay, so again, less than 6 feet away for more than 15 minutes. This really eliminates some of the more casual encounters we may have with people as we pass by them in a store or as we pass by, even in the office, if we have a brief conversation in the break room, where we're somewhat close, that eliminates that. We're focusing on less than 6 feet for more than 15 minutes. We ask the case to notify their employer because we know that lately a lot of our contacts have been at home and work, because we haven't had a whole lot of activity with just social lives and things like that. So we do ask the case to notify their employer so that their employer then can help evaluate in the workplace to determine whether there's any potential exposures there. And then each contact is called, each close contact that we get, we ask the case to give us, to see if they have a way for us to call them, and then we actually do call them, and we ask them if they're symptomatic. If they are, we treat them exactly like we treated the original case and go through that same interview process. If they're not, we recommend the quarantine procedures. We recommend testing for folks that are close contacts, and so we really try to emphasize to people to seek out that diagnosis, but at a bare minimum, making sure that those folks are staying home. So even the asymptomatic ones, if they develop symptoms later, they haven't had a whole lot of encounters with other people. So just as a reminder, the isolation and quarantine requirements. So isolation when people are sick or they have confirmed cases is for at least 10 days from when the symptoms began. They have to be fever-free for at least 3 days, and that again was with no fever-reducing medications, and the rest of their symptoms have to be significantly improved. If all 3 of those criteria have been met, these folks can be released from isolation. Asymptomatic contacts of cases actually need to be quarantined for as long as 14 days from the last point of contact, because we know that it can take up to 14 days before symptoms develop, and we want to make sure that they're quarantining when those symptoms develop. So additionally, each case, in addition to calling these folks initially, each case is followed up at the end of their isolation period to make sure that their symptoms are resolved and to make sure all the rest of the release criteria are met. So each case has at least 2 phone calls, and so the job of the contact tracing, especially in a county like Woodbury where we've had so many cases, is a tall order. There's no question about it. At the health department, we've struggled through this challenge, and yet we've maintained that local presence that we felt like our community needed. And so again, we've enlisted the help of almost everybody at the health department, from people that do this all the time to people that don't do this all the time and had to have some just-in-time training. We've enlisted the help of neighboring counties like Plymouth County and Cherokee that were gracious enough to help us early on when we had a major spike. We've had help from a disease prevention specialist who works for IDPH out of our office. They've let her help us with these kind of cases as well. So even as cases decrease in our county, the contact tracing is going to go on, and there's a lot of work yet to be done. Again, we've seen a lot of improvement, but we want to continue to keep up those social distancing practices and have responsible interacting behavior from our residents so that we can continue this downward trend. So with that, I will turn it over to Captain Clark from the Salvation Army.
Well, thank you. The Siouxland Salvation Army would just like to make everyone aware that we are here, we're serving, we're helping people with food and other social services. We're committed to keep doing that. We have seen as much as a 500% increase in food needs, but we've been able to be well prepared for that through the generosity of individuals and businesses, and we'll keep helping folks in that capacity. We're looking forward to opening up new programs to help people throughout the long-term recovery. We have specific programs for seniors and those who cannot leave their houses, whether they're quarantined or whatnot. We're actually delivering food and other care items to those individuals as well. Thank you.
All right. We're going to open it up for questions, and we're going to start with KCAU.
Tyler, what have we learned about the virus so far that we maybe didn't know when we started, and how has that changed your recommendations for folks?
Yeah, so the question is about what we know now versus what we knew several months ago, and I think the answer is a lot. But probably one of the biggest things is the degree to which asymptomatic or pre-symptomatic people can spread the virus. Okay, the information that was obtained from the SARS episode that we had years ago provided a lot of the early information that we had about this virus, because it's a coronavirus that's similar in nature to the SARS virus years ago, and so a lot of the same principles, because it was new, a lot of the same principles that we learned then are what we assumed was going to be the case here, and it was always thought that this virus is most easily spread when you are the sickest. Okay, and that's still true, but we didn't probably place quite enough emphasis on asymptomatic spread, or probably more accurately what we'd call pre-symptomatic spread, the way that you can spread the virus before you get symptoms. And so because as things have changed with asymptomatic and pre-symptomatic spread, that has changed what we've done. It changes when we go back to contact tracing. We ask them, okay, so who did you come in contact with at least 48 hours before you even got sick? So we don't just start on the day that they got sick, we start a couple days before that. So those kinds of things, and I would say, again, there's lots of things, but probably the ones that jump out the most are the amount of asymptomatic or pre-symptomatic spread of this virus.
And then Captain Clark, how has this situation changed your organization's needs in terms of donations and volunteers?
Sure. Of course, the amount of donations that is needed to fulfill the demand has increased substantially. Like I said, we've seen as much as a 500% increase in a weekly distribution of food. Our volunteer needs have also changed. Many of the people who were volunteering to help prepare food boxes and man the food pantry and things like that are some of them don't feel comfortable being out at this time. So we do need people who are able to help in that capacity. And people can contact us with either donations or wanting to volunteer. Our phone number is 712-255-8836. Thank you.
Thank you.
All right. KTAV.
Yeah, so with the new shipment of PPE coming in, will you guys be able to start going back to that single use, or will you have to continue reusing stuff?
The reuse versus single use was the question in regards to PPE. That is directed by the Iowa Department of Public Health and the governor's office at the state level. So we will have to continue to follow the guidance that is set forth by them. But we have noticed a dramatic decrease in the amount of requests from our local agencies due to the fact that those supply chains are opening up.
Absolutely. And with the decrease in positivity rate that keeps happening over the weeks, is that because we're seeing less people coming in to get tested, or is that number kind of staying the same?
No, so the positivity rate, so the question was, with the positivity rate going down, is that a reflection of less people being tested? That's the advantage of using the positivity rate, because it factors in the amount of people tested. Yes, there has been a little bit of a decrease in the amount of people tested, which does factor into a few of our total cases going down. But again, that's why we look at that positivity rate, because no matter how many tests are done, that percentage of positives is still a good indicator. So one of the things when testing goes down, that is also, it's not necessarily an indicator of decreased testing availability. It sometimes is an increase, is a decrease in the demand for testing. If less people are sick, if less people feel the need to be tested, that's going to decrease the demand. So a decreased demand for testing, I think, is a good thing. That means that less people are ill. That means that less people are feeling the need to be tested because less people have come in contact with it. So again, positivity rate factors in the number of people tested. So when you look at that stat, that factors in any decrease or increase in testing numbers.
Absolutely. And then you spoke about contact tracing. Has that kind of been coming up? Do you guys expect to see an increase of numbers now with all this contact tracing you've been doing?
We've been at this contact tracing now for 2 months. So this is something that we anticipate as our case numbers go down, is that there's going to be fewer people that we have to trace. So yeah, I would say that we would expect our contact tracing to decrease. We hope to be able to release some of our employees that are doing some contact tracing now. We hope to, as things begin to open up and as programs start to get back to normal, we hope to be able to release some of our employees that are doing contact tracing back to their regular jobs. But yeah, we anticipate this contact tracing effort to be ongoing for several months to come, because it's going to, even as cases dwindle, that might even place more emphasis on the need to know where cases, when they do pop up, where they came from, and to limit, a bounce back or a second surge or something along those lines. So contact tracing is going to be with us for a while. The exact numbers and what that looks like, we don't quite know, but we do feel like as the cases decrease, our contacting tracing efforts should somewhat decrease as well.
Thank you.
All right, then we have Katie with Iowa Public Radio.
Hi, thank you all. Yeah, so Tyler, in regards to the number of contact tracers here, just making sure, you mentioned the over 40 employees have participated in contact tracing. And I recall you mentioning a couple weeks ago that you guys had 20-some contact tracers. So has this build up to 40 happened over the last couple of weeks, or is there really 40 that are available to do this and maybe 20 will do it at one time?
Yeah, I would say that it has increased. We had, probably 2 or 3 weeks ago, we probably were sitting at approximately 20 folks. And then as some of this is a product of some of the services that our employees are doing in their regular jobs. As those have decreased or changed, then that makes more people available to help out with the contact tracing. And so, especially as we saw, our surge in cases a few weeks ago, we decided at that point that anybody that was available, that had the time to do this, we could train them, get them going on that. There was some technology things that IDP, Iowa Department of Public Health, helped us with, that enabled people who don't have the state database access to help with contact tracing. This is a similar effort to what they're using with the National Guard with counties that are not doing their own testing. We were able to use some of the surveys and the technology that they're doing. So it's a number of factors, but there's no question about it. We have increased the number of people that are doing this, and we just decided that it was important for anybody at the health department that was available be trained on how to do this.
Gotcha. And then if a contact tracer reaches out to someone who has COVID-19 and they don't pick up or return their call, and they've made repeated attempts to contact that person, how is that handled?
Yeah, the downside, if there's a downside to these efforts, and this is always the case whenever you do disease investigation, we are absolutely dependent on the individual to give us information. With a lot of diseases, we have a lot of information from the doctor's office. So even if we don't get a hold of the patient or the case, we can usually get a lot of information from the doctor's office. COVID-19 is a little bit different because most of these people aren't seeing doctors. They're going through our community testing site and things like that. And so while there's, we're not always able to get a lot of information from the medical providers. So unfortunately, there are cases that we have to determine that we were just unable to get a hold of them. It's unfortunate, but we absolutely are dependent on people returning our calls, answering the phone when we call, and helping us and cooperating with us to give us the information.
So if people don't respond to contact tracers, then do you feel like there's a sense that the picture that's displayed in Woodbury County of the COVID-19 cases here is not necessarily a complete picture?
No, I think we have as complete of a picture of where things are in Woodbury County as anywhere in the state. Again, we have over 11,000 people tested. We have over 10% of our entire population has had a COVID-19 test. So, every county has people that don't respond to investigation efforts. And so I feel like, sure, would I love to get 100% of those? We absolutely would. It would benefit us to a certain degree. But I feel like Woodbury County residents, if they're concerned about it, have all kinds of access to get testing, and if we don't catch them through the contact tracing efforts, we'll catch them through the testing efforts on their own that they do on their own. So I feel like we have as good a picture of what's going on in the county as anybody in the state does.
Gotcha. All right, that's all my questions. Thank you.
All right. Did we have KSCJ join us? How about the Journal?
Yes, hi, this is Brett Hayworth. Thank you for this, Tyler. I had two questions. What is the position, and I haven't been on a lot of these calls, I've done them intermittently, but what is any stance or position that Siouxland District Health has on whether county residents should wear masks or not wear masks out in public?
We're taking the same stance as the CDC and Iowa Department of Public Health would. We're following right along in with that. CDC recommends that people wear masks when they're in public, when social distancing is not possible. IDPH has echoed that and generally feels like it's a voluntary effort. Certainly nobody at the health department level is going to require masks. But again, we feel like it's a good idea. If distancing is not possible, then taking that little bit of added precaution for masks would be advised.
Okay. And then other question. You cited at the beginning the number of positive cases and the trend down over 3 weeks. And I think we had another death today. What is the trend on deaths? That seems fairly steady off the top of my head.
Yeah, that seems pretty steady. I haven't honestly taken.
The 1 week trend on now.
I'm sorry. What was that, Brett? I started to interrupt you. I apologize.
Yeah, what would be the trend of deaths in Woodbury County? Is it holding steady? If you go back 1 week, 2 weeks, 3 weeks, off the top of my head, it seems like it's steady, but I don't know.
Yeah, I would say that it's fairly steady. I haven't actually taken the time to graph it out. If you follow our reports, you're seeing, 1, 2, over the weekend we had a few more because we had a long weekend and we didn't report every day. So there were 4 over the weekend or 3 over the weekend. But if you look at it right now, that's a pretty steady line. And you would expect the hospitalizations and the negative outcomes, the deaths that we've had, they're always going to trail the cases. Those types of outcomes usually follow, a couple of weeks of illness in most cases. So I would expect that some of those type of trends would also start to edge down. We would have a few more days. Of course, just having one a day with as many cases as we've had, honestly, the death rate has been decent in comparison to other parts of the state, that had a lot higher fatality rate. So when we've had 1, maybe 2 cases per day, I would expect that to stay fairly steady for a little bit longer, because again, that tends to lag the new cases because most people don't instantly have serious complications. It takes a little bit of time. So hopefully over the next few weeks we'll have a few more of those days where we can report 0.
Right, and just saying this back to you, so while the surge of cases was happening in April, I guess, early May, deaths is a lagging indicator because it takes people have to be sick a while before they unfortunately pass away from this.
Yes. Yes, that's absolutely true, and that's one of the things that we noticed early on. We were, when we had hardly any cases, we were sitting here at 5 cases or 10 cases. We were sitting there when we were wondering, "Gal, are there a lot more cases out there that we just don't know? Is there just this bubble that we don't know about?" But what we know is the hospitals were also empty at the same time. Our doctors' offices weren't getting bombarded with calls. So we really feel like our case counts have really mirrored the medical picture in the community. And so as our case counts went up, the hospitalizations and things like that went up right along with that. And so we hope that that continues as we start our downward trend.
Thank you.
All right. Again, I just want to thank everybody for joining us. Thanks to Tyler at Siouxland District Health and Captain Chris Clark with the Salvation Army for joining us today and sharing their information. Have a good weekend.
Again, that's Rebecca Socknett from the Woodbury County Emergency Management Division wrapping up today's media briefing concerning coronavirus and COVID-19. 2 points to pass along. This is the 3rd straight week now that cases have continued to drop here in Woodbury County. The number today being passed along, 261, and that's down about 50 or 60 from just a week ago, the 3rd straight week. Also, Woodbury County now leading the state of Iowa in testing. The county #1 in Iowa with more than 11,000 tests now being conducted. That's more than 10% of the Woodbury County population having been tested for COVID-19. There's been a lot of emphasis on the Test Iowa site that was here for a couple of weeks. And Tyler Brock from Siouxland District Health noting that less than 720 tests came out of that site. So the majority of those 11,000 done by local health agencies. Much more to pass along from today's briefing. We'll have that for you this afternoon at 5, 6, and late tonight at 10. In the meantime, enjoy your afternoon. We'll return you to regular programming. I'm Tim Seaman.